Good morning. I am Dr. Sambi Abraham, Director, Abraham's Infertility and Gynec Center, Chennai. You know that pain abdomen is a common complaint in the women of the reproductive age. Sometimes it gets ignored. Now, whenever there is a pain in the abdomen, we have to we have to think about certain facts. We have to see whether there is pain during urination or is it related to food intake. Now we have to understand that whether it is related to the periods any particular time in relation to the periods, or whether she has spotting in between, that is bleeding from the vagina, or she has abnormal discharge with foul smell, or is the pain related to intercourse, or is that she feels fatigued, or whether she feels full when she takes the food, abdomen is always irritable. All these things has to be endured by the patient. If there is associated fever, all these things has to be endured upon. There are many causes. One of the commonest causes is endometriosis. That is where the uterus lining gets outside the uterus. It could be in the ovary, it could be in the uterus, which is called endometriosis. So as we all know, during periods, what will happen? The endometrium is getting shut out. So in a patients with endometriosis, this bleeding takes place into the ovary, in and around the uterus and ovary. So what will happen? These organs get stuck together, and this is called endometriosis, and it can cause pain in the lower abdomen. Tumors of the uterus, like fibroids, can cause problems. It can press upon the bladder and cause urinary retention. Sometimes this fibroid can come in the support of the uterus, that is called the broad ligament, and it can press upon the tube which is carrying urine from the kidney. It can cause this problem. Infection of the uterus ovaries can cause this problem. This is what we call as the pelvic inflammatory disease. Or it could be that the women in the reproductive age could have an ectopic pregnancy. That means you know that the sperms and egg bind in the tube, and from there they are migrating to the uterus. Here what will happen is that this embryo may grow in the tube. So sometimes they may be having even a period like normal period like blood flow. So they may miss in between. It could be an ectopic also. So it could be a problem related to the bladder. It can be even a sign of an ovarian cancer. That means a tumor of the ovary. So it could be due to the blood flow abnormality in and around the uterus, which we call as the pelvic congestion syndrome. Or it could be a part of the spasm of the muscles which is supporting the uterus. So what I mean to tell is that pain in abdomen in ladies can be due to so many causes. It should not be ignored. You have to consult a doctor, do a scan, and find out the cause of the abdominal pain. Never ignore the abdominal pain, taking it casually that it could be due to the food I took, or it could be that my indigestion, or it is due to acidity, or it is due to travel, or my stress, like that. Don't take it casually. There can be innumerable causes of lower abdominal pain in ladies, especially if the pain is radiating to the back and sides associated with fever, with alteration in menstrual pattern. It should never be ignored. Ovarian cancer, we have to understand that may not give you definite symptoms. It may be very well mimicking the signs of a acidity or a gas in the abdomen. So what will happen? It often gets ignored, and once you have to always understand that all these things are diagnosed late, it can cause problems. So there are a lot of treatments available now. All these things, if we take it early, has got a very good cure. And so what I mean to tell is that lower abdominal pain ladies should never be ignored. There could be medical reasons behind it. There could be uterine causes behind it. There could be problems in the ovary behind that. So it has to be found out by clinical examination and by scanning. The purpose of this channel is to educate the ladies about the symptoms they have. You know, the ladies are the backbone of the family. So if there is a concept that she has got so many responsibilities, so she often ignores her symptoms. This should not be the way. These symptoms has to be looked upon and has to be treated accordingly. Otherwise, if any problems happens to her, the whole family gets affected because she is the backbone of the family. So all these things are put apart by the feeling that it takes a long time. No, it takes only 3 or 5 minutes for the diagnosis. But don't carry away with the symptoms. Don't think that these tests are costly, so I should not do that. No, it has to be done and has to be detailed, evaluated, and treatment has to be ensured.